Hello everyone, my name is Sasan Arya and I'll be presenting why oral hygiene is not just a dental issue. It is a crucial component of public health. This presentation is based on my recent opinion editorial and explores the deep connections between oral health, chronic diseases, and broader health equity concerns. We also see how oral hygiene fits into the environmental health frameworks, often in ways that go unnoticed. We've all heard that brushing and flossing are important, but how often do we think about oral hygiene in the context of heart disease, diabetes, or maternal health? Oral health is commonly treated as secondary or cosmetic, but in truth, it is foundational to overall well being. Public awareness and health policies have failed to fully recognize this. Oral hygiene doesn't just prevent cavities, it prevents major systemic conditions, and its neglect leads to real harm, especially among vulnerable population. According to CDC, nearly half of American adults over 30 have some form of gum disease. That's a massive number. This isn't about cosmetic concern, it is about inflammation, infection, and systemic stress on the body. Gum disease increase the risk of cardiovascular conditions, respiratory issues, and can even influence cognitive health. Yet, many people don't get diagnosed until the disease is advanced. Prevention and early detection must be emphasized in national health discussions. Inflammation is a common term in many chronic illnesses. Gum disease creates chronic inflammation that spreads through the body. When oral bacteria enters the bloodstream, they trigger immune response that can harm blood vessels and the organs. Disease is particularly concerning because systemic inflammation is known contributor to heart disease. Treating gum disease may not just preserve your teeth. It could help protect your heart and arteries for long-term damage. American Heart Association has shown that people with gum disease are at higher risk of heart attacks and strokes. Oral bacteria have been found inside arterial plaques. Meanwhile, researchers studying Alzheimer's disease are also looking into the role of oral pathogens in brain inflammation and amyloid buildup. The mouth and brain may seem far apart, but they are biologically linked through systemic circulation and inflammatory processes. This makes oral hygiene a potential modifiable factor in neurological health. Diabetes and periodontal disease have a two-way relationship. High blood sugar weakens the gum and immune response, while untreated gum disease makes it harder to control glucose levels. It's a feedback loop that worsens both conditions. Clinical studies shown that patients with diabetes who treat their gum disease experience improved glycemic control. Oral care should be a standard part of diabetes education and management, yet it is rarely discussed during the primary care visits. Pregnancy increases the body's susceptibility to gum inflammation. Studies link maternal periodontal disease to premature birth or low birth weight. These outcomes are serious, yet often preventable. Unfortunately, many pregnant individuals do not receive dental care due to lack of coverage or misinformation, including dental screenings in parental checkups and educating expecting mothers could reduce these risks and improve maternal child health outcomes across the country. Economically, it is far cheaper to prevent oral diseases than to treat them. According to ADA, every $1 spent on preventive dental care can save up to $50 in emergency and chronic care costs. Despite this, 76 million Americans lack dental insurance. This means we are spending far more on hospital visits, and late stage care than we would on routine cleaning and education. Oral health policy is not just a health issue, it is a matter of economical sustainability. Environmental factors directly affect oral health. For instance, access to clean, fluoridated water is critical for preventing tooth decay. But many communities, especially rural and low income areas, lack this basic infrastructure. Exposure to industrial pollutants like leads and mercury can weaken oral tissues and impair immune response. These examples show how environmental health and oral health intersects. Clean water, good sanitation, and toxin regulation are essential to achieving oral health equity. Despite the science, dental care is still treated as optional in many public programs. Medicare does not include routine dental coverage. Medicaid varies widely by state, meaning your access to oral health care depends on your zip code. This lack of national standardization creates confusion, inequality, and missed opportunities for prevention. Oral care should be integrated into all major health policies with clear and consistent funding across the board. The people most affected by poor oral health policies are often the most vulnerable. Seniors on fixed incomes, families in rural areas, and people of color experience the highest rates of untreated oral disease. These disparities are preventable, but we must make access to dental care universal and equitable. No one should suffer tooth loss or chronic illnesses because of where they live or what insurance they have. There are several practical solutions. We can mandate dental coverage in Medicare and Medicaid. We can expand mobile and dental clinics and invest in public health messaging that connects oral hygiene to long term health. Schools can offer fluoride rinses and dental sealants, and we can build partnerships between public health departments and environmental agencies to ensure clean water access for all communities. In conclusion, oral hygiene is a foundation of overall health, not an afterthought. It is time for health policy to reflect this. From chronic disease prevention to environmental justice, oral care intersects with nearly every major public health goal. If we want to improve life expectancy and health equity, we must start with the mouth, the gateway to the body. Thank you so much for your attention.